Hey everyone, Dr. Devin, Greenwich Chiropractic. We're talking a lot about TMJ. And so many people, I'm sure you know someone or you yourself has suffered from TMJ. Basically, the TMJ is where the jawbone inserts on the skull. And there's actually a little disc that sits in the middle of that. And it's important for proper motion and function of the jaw. And so when we start to lose that, it can be from a variety of causes, whether it's arthritis, muscle tightness, scar tissue, injury, or even that disc being out of the proper position. We get a lot of grinding, clicking, popping, trouble opening, trouble closing, trouble talking. Maybe you can't eat the foods that you normally eat, apples, hamburgers, for example. All of those things affect our daily life, and those are things that we typically take for granted, right? So when we evaluate the jaw, because there are multiple different causes, we want to make sure that we do a careful examination and testing to understand exactly what the root cause is when it comes to the TMJ. And we have a multitude of options in here where we can treat it conservatively that are very effective. And when we talk about treating TMJ, a lot of times what the standard is seeing, a dentist, which is a great option, night guards, which can sometimes get expensive, or getting to the point of seeing an oral surgeon or an orthodontist to the extent where now we're spending $5,000, $10,000 to try to realign our jaw. So if we can do it conservatively, that's great. And one of the tools that we use in the office to be able to do that is something called an arthrostim. So it looks like this, and it makes percussive kind of vibrations to help restore the function of the jaw, break up things like scar tissue, pump out swelling and inflammation, work on things like trigger points so that we can get that jaw tracking and functioning properly. Function dictates pain. So when we lose function or we alter function in the jaw, 9 times out of 10, the body's gonna let us know in the form of pain. So if we can restore that function to that area and reduce the pain, then you'll feel good into the future. Keep in mind, this is something that's so prevalent and common to the point that if you look at someone who's had long-standing TMJ, one side of their face actually looks different than the other. And it's the reason because of all this swelling and inflammation and muscle spasm that you have in the area. So once that calms down, not only will you feel better, but you're gonna look better too. Thanks so much for listening. We'll see you on the next video.